Wellness, and we are in the mission of transforming people's life all across without a non-surgical method. And here I am introducing today Dr. Joseph Camarata from USA. He is expert in spinal decompression technology, and we are going to have a lot of insights today, to understand how these new methods are working, which has already been existent in USA from last 35 years, and there people have been beneficial by using those techniques. But here in India we had been deprived of it, and especially in Karnataka we have introduced it, and we are the first one there. So I want all Kannadigas and people all over to use that technique and have best of spinal health. So we will have a lot of information today in presence of Dr. Joseph, and he will be taking us through all those special techniques which is going to help you to come out of these diseases without any surgical interventions. So, hello, Dr. Joseph.
Hello, how are you?
Yeah, doing very good, thank you. So, our audience would like to know, first of all, what triggered you to get into this technique, spinal decompression technique? What was your inspiration behind it?
I met the person who developed this technique. His name was Dr. Alan Dyer. He was the former Deputy Minister of Health in Canada, and he had developed a non-surgical treatment for disc herniations, disc bulges, degenerative disc problems. He was a physician, his wife was a physician, and they both had disc issues. Because they knew the risks and dangers associated with surgery, they didn't want to do that. So he was also an engineer, and so he started to work on a treatment that could treat the disc successfully without having to have surgery. So he came to me at a very large clinic in the U.S., and he said, I want you to take a look at this treatment and start using it. And we did. And when I saw the results, my practice shifted from doing the chiropractic and physical therapy treatments to doing the spinal decompression.
Okay, that's wonderful. So mostly what happens is when anybody is going through spinal pain or any pain in the body, first thing which comes in the mind is let's go to the physiotherapist.
Yeah.
So why people should go for decompression at first place?
Yeah, physical therapy is a great treatment modality for a lot of problems, and we have a lot of high regard for physical therapists. All of our clinics have trained physical therapists in them, as well as orthopedists as well. So all of our patients see an orthopod and they see a physical therapist. The difference is when we're treating patients who have traditionally surgical problems, physical therapy has limitation. It's a great treatment option once the problem is solved, but it generally doesn't address the problems that need to be addressed traditionally by surgery. So right now with spinal decompression, non-surgical spinal decompression, we can treat herniated discs, bulging discs, degenerative discs, discs that have traditionally been treated by drugs, needles, and surgery. We can treat non-surgically and get at least the same outcome without having any of the risk.
Okay, great to know. Wonderful insight, because there is no awareness of all these new methods, and people are forced to opt for such options, and where many a times a risk of death is involved and do not know how to overcome of post-surgical impacts.
Yeah.
So this is really wonderful, and good to educate people about all these new techniques.
Yeah.
And they can get a lot of help out of this. So one thing, Dr. Joseph, which is there in my mind also, any pain if I get or any discomfort in my body, we rush to the hospitals and our doctor suggests, oh, this is very critical, and you go for the surgery. So why should somebody not go for the surgery and they should choose decompression technique for any of the spinal issues? Because as we understand, and all of us understand, spine is the base of our body, and any error, any 0.1% error also can damage it, and people can get paralyzed and can be bedridden throughout the life. So why should people trust us and they go for decompression over surgeries?
Yeah. So there's two things I want to make very clear. One is that this treatment is not for everybody. It's not a cure-all. It's not the panacea that everybody who comes gets better and everybody is a candidate. There's an absolute place for surgery. There's an absolute place for medication and injections. All of those things have their place. My philosophy has always been that we always have that as an option. So let's exhaust all the natural options before we do that. I always say you only get one bite of that apple, right? Once you take that bite, there's no turning back. So let's leave that as the last option. Again, there are certain problems that have to be addressed by surgery. If a person comes to us and they show with certain conditions called equine eye syndrome, there's a number of them. They're surgical emergencies. If it's not a surgical emergency in the spine, then that can be left as the last resort. So our goal is to accomplish the same things that are accomplished in surgery, alleviate the pain, get the patient back to all their normal activities of living without all the dangers and risk and recovery time necessary with surgery.
That's wonderful to know, because any discomfort in the body, people get into fear and they just rush here and there looking for different options, and they get into whatever first solution they get. So it is really wonderful to know that why should they be opting for decompression over surgery.
Yeah. Always choose the most conservative option first.
Absolutely. Thank you so much.
My pleasure.
Why people should choose ANSAI over many other decompression techniques would be available all over?
Yeah, well, there's a number of reasons for that. First of all, we have a tremendous team here at ANSAI. We have over 120 employees, everybody focusing on a specific area of our practice. I personally have been doing spinal decompression for over 35 years. I can say that I probably have more experience than anyone in the world at spinal decompression. I published a research study with a very large insurance company in the U.S. and continue to work on improving the protocols and improving the equipment. One of the things that we've been able to do is create a table specifically for ourselves. We've worked on the original device and made some modifications to the protocols. So there's more to spinal decompression than just pushing a button and the patient gets better. And we feel at ANSSI that all of our people who work for us have been trained properly, and our protocols are specific. Every patient is different. We treat every patient differently, and I think that's what sets us apart.
That's so wonderful to know. We are addressing in ANSAI, we are addressing a specific issue in a specific way. That is, good to know that, you go to any centers all over and they overcome it, and they, without delivering those. And at the end, we are also experiencing in our Bangalore center that people are coming depressed after not getting solutions, trying multiple things, and still they are in the same pain. And actually, it aggravates more and more how much you avoid it and you do not get proper solution. So they are so depressed and they are finding it, to build that trust, regain that trust, and understanding that how efficient we are into spinal, recovery without even losing your pace, without even, going for any post therapies. You can just, enjoy it like a spa. You can come here and, within 45 minutes of treatment, you can just rejuvenate and you go back to work, productive lifestyle. So, and I believe it is based on the natural philosophy as well, because as much as these days we are getting away from the natural lifestyle. So as much you follow it and you follow our decompression techniques, which is even closer to the natural lifestyle also, which is certainly going to give you best of the health. All the best, our audience, and thank you so much, Dr. Joseph, for coming to us and giving a lot of insight about this specific technique. Thank you so much.
Thank you.
Thank you.